All right, it is 10 o'clock, so let's get things started. Good morning. Welcome to the February 16th Public Health Media Briefing. You will hear from Dr. Kassirier, who's going to give you an update on our case numbers and the rescinded public health orders. And then you'll hear from Rachel Allen for a vaccination update. And Carlos is going to give us a testing update. Dr. K, I will hand it over to you.
Sure. Good morning, everyone, and thank you for joining us. So with the numbers, and this is from yesterday, 274,155 cases of COVID-19 reported to Sacramento County. We're averaging about 500 to 600 cases a day. Our case rate is at 38.2 per 100,000. So this is a drop of about more than 75% from our peak of 240 last month. With the deaths, we're at 2,837. The deaths have picked up. We're averaging about 9 to 10 confirmed deaths per day. And again, just to note that the process for confirming deaths is a little lengthy. So we still have some that are pending confirmation. The hospitalizations have started to decline. The most recent update we have, we're at 415 hospitalized with 66 in the intensive care unit. The jail outbreak is also looking better. From the update last week for the main jail, the last week numbers were 150, and that has dropped to 52 from the update today. And for our CCC, last week it was 236, and it has dropped to 91 today. Today, the state universal indoor masking mandate ended, and this was issued in December. And it ended today. And in alignment with that, Sacramento County is also rescinding the two local orders that we have had. One was for universal indoor masking, and the other was for virtual public meetings. And both of those are posted on our COVID website. It is important to note that the masking mandate now reverts back to what the state had prior to December 15th, which means that it will still be required in certain settings, which include public transit, indoor in schools and childcare, emergency shelters, cooling and heating centers, healthcare settings, state and local correctional facilities and detention facilities, homeless shelters, long-term care facilities, and senior care facilities. Indoor masking is also still required for people that are unvaccinated. So for businesses, and this is a question that has come up to us, is if a business can either require people that patrons that are coming to that business to either self-attest, or they can still go with requiring masking for everybody regardless of vaccination status. One last update is that if you go to our dashboard, you will notice that there will be a pop-up that comes up. Beginning February 28th, we are going to change the frequency at which we are updating our dashboard. So most of the updates will go to weekly, with the location information being updated on a monthly basis. And this is in line with as we get to the end of this surge, and as we see that, as we continue to monitor, and hopefully that we'll see a continuing decline in our numbers. So that I will turn it over to Rachel.
Good morning.
This week, the CDC Advisory Committee was scheduled to meet to review that much anticipated data that Pfizer had submitted for infants and children 6 months to 4 years old. And we had expected, if that was approved, that we would see that vaccine roll out in the next few weeks. I'm sure most people have seen that meeting is postponed. And the FDA has decided to wait for more data to show how well a third Pfizer dose will work for a portion of this population, specifically those 2 to 4 year olds where the 2 doses didn't seem to produce sufficient immunity. So that rollout is postponed. The data is expected by early April. If you're a family with children in this age range, please continue to take precautions to protect them from exposure as you have been doing. There's also been a few changes and recommendations for those people who qualify with certain immunocompromising conditions. I do want to touch on that briefly. Again, these are for specific conditions and the CDC has specific guidance for these people. If you've received a J&J, a single dose of J&J, you now should receive an additional dose 28 days later, and it needs to be an mRNA vaccine, so Pfizer or Moderna. And then also qualify for a booster dose, again, preferentially an mRNA vaccine. So a total of 3 doses for those who started with J&J. If you qualify for one of these immunocompromising conditions and you started your series with an mRNA vaccine, the CDC has shortened that interval between the primary series and the booster dose down to 3 months instead of 5 months. So again, look at your card. If you think you qualify for one of these conditions, see how long it's been since you finished your primary series. And then lastly, they did clarify that, again, if you qualify for these conditions and you have had 3 doses of the primary series of an mRNA vaccine, you still need that additional booster dose for a total of 4 doses. A lot of information there. So just encouraging folks, if you qualify, if you think you have one of these conditions, please look at your CDC card, see how long it's been, and then consult with your medical provider to make sure that you're getting the right vaccine at the right time frame. And then lastly, just with the changes that are coming about in our community with masking guidance, we want to remind folks that the very best protection against severe disease is to be vaccinated. And that means being fully up to date with that primary series, as well as being boosted when you're eligible. If you've completed your primary series for the COVID vaccine, that does mean that you're considered to be fully vaccinated, but you're not up to date unless you've had that booster when you're eligible. So please look at your card, see if it's been the appropriate length of time for you to receive your booster. And if it's time, look for an appointment today. Our COVID vaccination team today is out in the Citrus Heights community at the community center from 10 to 2. If you live in that area and you're not fully vaccinated, please feel free to come by. We always welcome walk-ups. We have all 3 COVID vaccines available and would love to see you. If that doesn't work for you, please, you can check our website to see the other locations that we're at, as well as sites that are hosted by some of our partners, and that's on our Sac County website. And I will turn it over to Carlos to talk about testing.
All right, thanks, Rachel. So Sacramento County has been monitoring and responding to the changes related to testing. During the Omicron surge, we added staffing and capacity to our existing sites and extended their existing timelines. As we see decreased case numbers and decreased demand for testing, as well as additional testing access points available in the community, Sacramento County is modifying its approach to its community testing program. As of March 1st, the community testing program will go from 13 to 7 sites. The county will continue to monitor community need and engage proactively with community-based organizations, our health system partners, and FQHCs to make changes to this plan should we see a change in needs. Still, we encourage and want folks to get tested when they need it. As a result, we have added additional testing days at one of our existing community partnered sites. The Robertson Community Center has been a trusted partner serving the community with testing for the duration of our community testing program. They now host free PCR testing 6 days a week, Monday through Saturday. Hours, appointments, scheduling, and additional details can be seen on our county testing webpage. Thanks.
Thank you all. We will now open it up to questions from the media. Please raise your hand and I will call on you if you have a question. Giacomo, go ahead.
Thank you, everybody. Dr. Kassirer, we're seeing really a lot of essentially downsizing in our attack on COVID. Is this optimistic in where we are with this pandemic, and is there a sign that we're starting to really reach the tail end of this?
Well, we are optimistic because, as I mentioned, our case rate has dropped from 240 in January down to 38 as of yesterday. So that is quite a decline. And the indications that we're seeing from the state is that projections is that those numbers will continue to go down. We're also seeing a decline in hospitalizations. And so we are adjusting our response based on the activities that we're seeing.
Michael with the B, go ahead.
Yeah, hi. I wanted to, in regard to the community testing sites going from 13 to 7, is there a list anywhere of which 6 are going to be closing?
Yes, our testing land page for the county lists all these sites, and we also have a flyer that we are sharing that has updated information about the sites, hours, days, and other details.
Karma, go ahead.
This is for Dr. K and also Carlos as well, because it, of course, would touch on testing. So as we move forward in this, we've seen over the last 2 years how quickly things can change. And specifically when it came to dealing with the Omicron, it feels like not just locally, but of course the country was dealing with this onslaught of an uptick in cases and really a lack of availability to switch gears very quickly. So given that we are ramping down now, what is the plan for being able to pivot quickly if necessary to reopen those testing facilities if it's deemed necessary, to expand the staffing and to get back at the levels that we were during the height of the surge if that seemed to be necessary?
Well, one of the things that we're still doing is definitely checking in with the state that is able to give us projections as to what is happening locally, as well as in other areas in the United States, as well as in other countries. So that will be give us an indication if the numbers are starting to go in the wrong direction. The other also is that now that we have more availability of at-home testing kits, I think that will help with being able to deal with any subsequent surges. And then, of course, we also monitor with the sites that we have open, and they will indicate to us if they're seeing an increase in demand, and that will enable us to be able to ramp up. And Carlos?
I would just add that, for all these sites, we're not starting from zero. So we've built a lot with experience and institutional knowledge and partnerships that we've made. I think that pivot that you're asking about could happen pretty quickly. And so I think we would rely on the experience that we've had so far in our ability to sort of operationalize testing all over the county. So.
And could I get a quick follow-up, Sam?
Yeah, of course, go ahead.
Okay, so along those lines, if you could give some specific examples of things that you learned last time around. I know that there were so many challenges dealing with Omicron, not just of being able to ramp up a larger infrastructure, but even dealing with things like many of the people that would be staffing these places were sick themselves, and those types of resources. What have you learned this time around, this particular surge, that we could take into, God forbid, we're dealing with this again in later on this year?
Well, one of the things that Rachel mentioned is that our vaccines are very effective. And I think being able to continue with getting the vaccine out and making sure that more of our community is vaccinated will help in being able to deal with any additional surges that come. And then, as Carlos pointed out, if there is any subsequent surge, we're not starting from zero, because we have definitely built up resources and also the relationships that we have built up with the sites that we have, that we would be more readily able to ramp up. To a certain extent, we are dependent on being able to get resources such as testing kits from the state. And I think that, again, with the state being able to look at projections as to what's happening in the next 2 weeks or the next month, that will help in being able to prepare if another surge comes up.
Mike, go ahead.
Yeah, regarding the shift from the data updates once a week to, or from daily to once a week. I see there's a note on the website that says that this is in part so that focus can shift from, universal investigation and contact tracing to preventing severe cases and helping the vulnerable populations. Could you give some specific examples of how, shifting resources away from broader surveillance to more focused on vulnerable population, what that might actually look like in practice?
Go ahead, Jamie.
Sure. So for us, it won't change a whole lot in terms of how we investigate, because we have an automated outreach system. We have seen a decrease in response rates to that automated system where we send outreach via text message and phone calls. However, what it might do is a lot of times when we don't reach people successfully with that automation, we have staff who will pick up the phone and try a fourth or fifth time to reach those individuals for an investigation. And we'll probably scale that back and have the in-person staff really be working with, the most severe cases. So hospitalizations, congregate settings, higher risk for vulnerable populations. So just less of a focus on the individuals in terms of person follow-up, but we won't be scaling back our automated outreach. I'm not sure if that fully answers your question, but and there's also, I don't know if you noticed on the webpage, we also linked to some changes in reporting requirements. And so it's also not reportable anymore so typically we get reports from 2 different entities, from the actual provider and from the laboratory. If we receive that information, a lot of times on a lab report, there's like maybe a birth date and sex, but there's not a whole lot of additional demographic information. And so if we don't get that information from a provider report and somebody doesn't respond to a case investigation inquiry, then we have fewer demographic data to be able to present.
Giacomo, go ahead.
I did have another question about schools for Dr. Kassirier. Yesterday, a number of parents began sending their students to schools without masks on. It appears parents are starting to grow a little impatient, saying the state's rules are lifting in some areas, but not in others. I know this isn't really in your authority because you're kind of hands are tied in terms of the school rules, but any messages for parents, especially after, Dr. Galley said perhaps at the end of the month we could have another answer on this, but any messages for parents in Sacramento County who may be deciding to do this and stressing just the importance of continued masking?
Well, my request to parents is that we ask you to be patient. We are reviewing the data, but I think it's important for parents to recognize that children can and are affected by COVID-19. This year, when we had schools open in person and we didn't have the social distancing, we did see an increase in hospitalizations in children, and some of them had very severe disease. So we want to make sure that we're able to protect the children. Some children have conditions that put them at risk. Also, some of the staff, the teachers, may have conditions that put them at risk. So I want to make sure that we have measures in place to keep everybody safe. I know that there, especially as the numbers continue to go down, that this will be a consideration in being able to make adjustments based on the data so that we're able to allow at some point allow more choices, but I think this is the time where we need to be careful in how we make those steps. And I think that the state taking these additional 2 weeks to continue to look at the data will help us to have more confidence in being able to make adjustments at the end of the year. I mean, at the end of the month, sorry.
Daniel, go ahead.
Yeah, that last question was one I had too. That's answered. But another question I have is with the, with cases falling so low, I know the initial goal was to get to 5 cases per 100,000. Do you think that that is like a realistic thing now, and kind of when you expect that would happen?
Well, Omicron is different because when we set that goal of 5 per 100,000, we were dealing with Delta. And if you recall, actually in December, we almost got to that. And then the Omicron surge started. So we don't know how far it's going to fall. I think what is very hopeful is that the numbers are declining very quickly. But I don't know whether with Omicron that is still a goal that we're able to reach. I think the next couple of weeks will help us to know that.
Okay, cool. And then one follow-up with the mandate ending, I think a lot of people are trying to decide, okay, are they going to go maskless to the grocery store, do things? Are they going to keep wearing the mask? And it's obviously for people who are vaccinated, it's their own decision. But, as you personally, as a health official, what do you plan to do now that this mandate is over? Are you going to still wear a mask when you go out in certain places? Or do you feel confident in the way things are right now, where you'll just be among those people that is not going to wear a mask?
You bring up a good point that as we take away the universal masking, that then we are leaving individuals to make choices in terms of their risk assessment, especially for people that are vaccinated. I have full confidence in the vaccine, and I am vaccinated and boosted, but I will still wear a mask, especially when going into certain public places, because each layer of protection that we use increases the our confidence in being able to avoid getting COVID. So I will be continuing to use the mask.
Any additional questions from media before we wrap up? Okay, with that, this concludes the public health briefing. As always, I will send out a recording of this briefing this afternoon. Thank you all for joining us.
Thank you, everybody. Thanks for your time.